How's it going, guys? I'm the real Randy Chavez, and this is Dr. Mark Nunez. He is owner of Levittown and Farmingdale Animal Hospital in Long Island. Happy Labor Day weekend. Happy 3 day. Although you have a 4 day.
Yes, I
It's,
do.
um,
I do. Yes.
So,
Happy Labor Day, everybody.
so as owner, when did you decide to implement the everyone gets 3 days weekends every weekend, and why did you choose to do that?
Yeah, early on, because historically in the profession we worked ourselves to death, man. There was no such thing as a 5 day week. Many veterinarians and team members work 6, 7 days a week,
Yeah.
60 plus hours a week, and it was just
So much.
killing people.
Yeah, it's a
It's
lot.
killing people. So early on, fairly early on.
So you think that's a reason for a higher suicide rate among veterinarians?
Oh, part of it,
Yeah.
sure. Yeah, part of it is, we work ourselves to death. Have what's called compassion fatigue. We get beat up by people thinking we're in it for the money, and I get it. If they have a sick animal and they can't afford treatment, people get emotional, and but sometimes they blame us for not caring, and we should just do it for free, and it's a lot more pressure in the profession than people think.
And were you the first hospital in your area to do it, or you saw someone
Yeah,
else do it?
no,
Oh,
that
okay.
was me. Yep, I didn't know of anyone else doing that,
Okay.
and at the time, the company I'm partnered with wasn't thrilled,
Okay.
because I was the first. I said, I'm going down. I'm not working more than 4 days a week, and then we just implemented that with the rest of the team, and yeah, they weren't happy about it. They didn't think I could make it work, but we did, and now more and more people in the
Yeah.
profession.
I know Long Island veterinary specialist lives.
Hmm.
They started doing that.
Oh, did they?
Yeah.
Oh, okay,
Did,
yeah.
did you, outside of your partners in the business that didn't want it, did you meet any resistance from any of the kennel workers, assistants?
No.
No, everyone loved
Oh,
it.
yeah. Who doesn't want a 3 day weekend every week?
I did not like that when
Why?
I chose because I don't know that old saying like idle hands are the devil's plaything. I
Depends what you're playing with.
I guess. Also, I wasn't much into really anything else. Just into like working out, maybe some video games. But I noticed that
So you just had
I
time.
I
and-
needed something to do every day, and if I
Gotcha.
didn't, I would just like 12 hours of video games, which I guess nowadays probably isn't that long enough anymore.
Netflix,
But
no.
yeah, Netflix.
Yeah,
I don't know
yeah.
if there was a Netflix like 10, 12 years ago. I guess there was. I
Yeah.
think you still had to
Oh yeah.
email or not send out for the tapes or the discs, and they sent them to you that way.
Oh really?
That's what they did before the
Oh
actual
wow.
thing.
No, but I work. I'm 4 days a week there, but I do a lot outside of there.
For the hospital.
Yeah.
For both of them. I
Yeah,
guess.
for leadership development, team building, a lot of continuing education, and extra stuff.
All right, and you've been practicing since what year?
I graduated in 2002, so
From where?
LSU.
From LSU.
Go
Okay.
Tigers.
So, what's been the biggest challenge nowadays as compared to 18 years ago for veterinarians?
Finding team members.
Permanent team member?
Yeah, yeah.
Okay, so
Yeah, hiring people. We've been short staffed for 4 years.
jeez. So the pool itself, not talking about like qualified workers, but the pool itself,
Mhm.
people just aren't in it anymore.
The pool itself has gotten smaller, and we hire for fit, for culture. I'm less concerned with skill set. I can teach the skill set in
Okay.
most cases.
And practice will make them
But-
get better.
Having the right personality to fit with the team, that is our primary goal in hiring. So that will further. I'm not just hiring a warm body, so that further slows the hiring process.
Okay. If is there a like for example, like if let's say you have a plan and right now you think you've assembled a pretty good team.
Mhm.
Is there any scenario in which, like for example, when I was getting out of the military, I was going to school to be a X-ray assistant, X-ray tech, and
Mhm.
then along the way, I found something that just paid better, was better for my time, and I got out of the military for that reason, and then
Mhm.
halfway through, I switched. Do you think there's anything that would tell you, hey, this is something that I should switch it up? We have to go back to the drawing board as far as team members and building.
Well, I guess the supply and demand concept, we choose our suffering. So I can either choose to suffer by being short staffed,
Hmm.
or I can choose to suffer by bringing on a team member that might not fit our culture but has a great skill set and can get the job done. So right now,
Pick your poison. You
yeah,
mean?
it's
Okay.
always pick your poison.
All
We're
right.
still trying to stick to hiring for culture, but now what we're really the applicants that we're getting have either no experience or little experience, and I'm okay
Okay.
as long as they
So you can teach 'em.
fit culture wise. That's going to take time away from seeing patients because we're going to have to train,
Yeah.
but in the long run, it'll be a good thing as long as they work out.
Okay. As far as I know, during COVID, everything's great. As far as, do you find, because of your way of dealing with COVID, saying, okay, clients stay in the car and we
Mhm.
take the patient from them, do you find that less FaceTime, it's harder and more difficult to get what you need to get information across? Or do you have
Yeah,
printouts?
it's different. It's different. Well, we get all the history and everything before the appointment, so I know what's going on. But still, with the face to face and with me doing the exam with the client present, the conversation is more organic, and things will come up in that conversation that'll make me want to look at something else. So it is different. It is different. But we're going to start allowing clients to come back into the building, only one per pet, mask and
Yeah.
hand gel and all of that. Still do the check-in and the check-out with them waiting in the car. Still have them wait in the car until it's appointment time.
Yeah.
So we're going to start moving in that direction in probably 3 weeks or so, as
Okay.
long as COVID rates stay low like they have
Right.
been here.
Have you seen any side effects or consequences of not being in the room with the owner at the same time? Have they?
Yeah, other than the owners not liking that, no, not really.
Okay. So are any new owners, people that have never been to a vet before, people that just get a puppy or kitten, what is the best recommendation you could give for finding a vet that suits them?
That's a good question. Well, in general, you should, if you find a hospital that is AHA certified, American Animal Hospital Association certified, those hospitals undergo inspection, if you will, every 3 years to make sure we are maintaining current recommendations of the profession and things like that. Just because you have an AHA hospital doesn't mean it's better than a non-AHA hospital per se, but it's kind of hard to know because and I think it's only 15% of veterinary hospitals out there are AHA certified. We are one.
And is that the U.S. wide or is that
Yeah.
statewide? Okay,
Yeah.
so it's not just New York.
No,
it's all 50
that's
states.
statewide,
Okay.
U.S. wide. So and these days, if they don't have a nice website that functions well, that kind of tells me a bit about their operation. Like
Even if they're in like the sticks of like Nebraska or Louisiana or Kansas.
Still, I think that these, in this day and age, people who want to keep up with things and keep up with new technologies and new things are going to be doing things like this. And price, you can't do it by price. It's tough. It really is difficult to because it's not only about. I mean, you can call and ask them questions. Tell me about your vaccination protocols. How often do you guys vaccinate? So if you get someone on the line that wants to vaccinate against everything every year all at the same time, not good. Not good.
Why is that not good?
It's too much. It's too much
immune
stimulation
system?
of the immune system.
Okay.
Exactly. It leads to autoimmune diseases, more vaccine reactions. Lots of.
Are you an anti-vaxxer?
No, I am not. I am not an anti-vaxxer, and y'all need to stop with that nonsense.
You sound a little anti-vaxxer.
No, not at all. Vaccines save millions of lives
Okay.
on the animal side and the human side, but they're not benign, and they can cause problems if not given appropriately. Like, the interval for how often we should be vaccinating dogs and cats was just arbitrarily set to 1 year, back in like the 50s or whenever,
Even though they worked for longer.
Well, they didn't know that then. There were
Oh.
no studies for about duration of immunity.
Okay.
So now we do know that the immune system of dogs and cats remembers some vaccines for long periods of time. So now we have 3-year distemper vaccine combo and 3-year rabies vaccine combo, but all the other ones are the immune system doesn't remember them as well. So some of them still need to be boosted, annually, and even the kennel cough vaccine in some cases every 6 months.
Okay, so if you have a vet or if someone here is going to a vet and they recommend every vaccine every year, you're saying that either that vet is just horribly misinformed or they're just looking to make money.
Yes, essentially. They are either misinformed or their business model is centered around vaccinations versus more of a wellness type of thing where we're getting blood work to look inside to make sure everything's okay in a patient that can't talk to us, but in fairness to a degree, that was veterinary medicine. I mean, it really centered heavily around vaccines. Like, not many people, more and more these days, but the first at least half of my career, nobody questioned. We got to go get the shots. Well, no, what you really need is a good physical exam. You need a veterinarian that's going to recommend cleaning your dog's teeth before they are rotting out of their face.
Yeah.
You need veterinarians who
are preventative.
Yeah, preventative. Yeah, you ever hear the saying, an ounce of prevention is worth a pound of cure?
Yes.
And it's a hell of a lot less expensive. Like, if I'll clean a teeth in a 4-year-old that just has a little tartar, like more tartar than any human would ever allow, but it's come to be seen as somewhat the norm. It's like okay, but it's not. I can clean a mouth like that 2 or 3 times for the price that it costs for me to clean one potty mouth where I have to extract 20 teeth. Yeah. And the dog doesn't suffer for years because it took years to get that potty mouth.
Yeah.
Dog doesn't suffer for years, keeps his teeth, not in pain, not risking heart disease, lung disease, liver and kidney disease, all of that.
So in humans, like, there's some humans, like, they won't even floss. They'll just brush, they'll be fine. And some humans will brush twice a day and they'll floss twice a day and they'll still have shitty teeth. Is that the same in dogs?
That's the likelihood of someone who brushes and flosses twice a day having bad teeth is the exception, not the rule.
Okay.
The vast majority of people who take that degree of diligence will not have bad teeth.
Okay.
There's always an exception.
So I was just asking if certain dogs will just, in general,
have
better
worse
teeth than others?
Yeah, small breeds tend to have really bad dental disease.
All right, so if you have a small breed, like under 30 pounds, you should probably... When would you recommend them start to getting...
Well, it depends on... 80% of my patients over the age of 4 have some form of dental disease.
Okay, so well before then, you should try to...
Maybe not, but at least by age 4.
Okay, and that's generally should be part of the exam?
No, the recommendation is made during the exam, and then pre-anesthetic blood work is taken, and then we go over the blood work and we schedule the dental for another day.
Okay, so I've heard you mention before saying that with vaccines, you really shouldn't have, as long as you don't cluster them all at one time, there's no side effects.
Nope, not true.
Okay.
There's a significantly lower chance of vaccine reactions. And I'm not talking about autoimmune disease, I'm talking about anaphylactic reactions. So there's always a risk of being allergic to the vaccination or getting an allergic response to the vaccination. But when we keep it to no more than 2 injectable vaccines per visit, in general, the statistics say there's a less than 1% chance you'll have a reaction.
Okay.
If we keep it to no more than 2 injectable vaccines per visit, it's significantly less than that in my experience.
Okay.
I mean, like probably half, less than half of a percent. So it's very rare.
All right. So if you have, what should someone do, and what are the signs that we should look out for if the reaction is delayed and it takes a couple hours, they get home?
Yeah. So facial swelling, itching, vomiting, diarrhea, hives, looking restless, panting and pacing and not being able to settle down.
Okay.
Those will be the signs of a systemic reaction. You can have a local reaction where there's a little sore at the side, or maybe you get a little lump. Well,
I feel like that makes sense.
That's no big
when I
deal.
get
Yeah, the local ones are no big
can't work
deal.
out.
Yeah. Well, it depends on the vaccine too.
Yeah.
Some vaccines will make you a lot more sore than others.
Okay. And for the food, since I was in years ago, there's been a couple of new companies as far as food. Where should people be getting the food? I know it can be breed specific. Any recommendations or foods to stay away from?
Well, yeah. If you're grocery storing it, IAMS is going to probably be one of the better ones you're going to find in grocery stores. I don't know. I don't go to grocery stores anymore, so I don't know what food they're selling there.
Gotcha.
In general, you want to stick with your higher quality name brands: Royal Canin, Science Diet, even Purina Pro Plan, not Purina Dog Chow.
Okay.
Wellness is a good one. There's a lot out there, and that's where it really can start to get confusing. And but you stay away from, if you can buy 50 pounds of dog food for $10, you're getting what you pay for. Like Old Roy and Pedigree and all of this. I mean, it's just like feeding junk food,
Gotcha.
for the whole life of the dog. A lot of people these days are cooking, and making food for their dogs at home, or feeding a raw diet. I'm not a big proponent of that. If it's done right, it's fine. It's just difficult to do right for many people long term. And if you're going to cook for your dog, I would strongly recommend you speak to a veterinary nutritionist. Petdiets.com. You can get a nutrition consult, and they can give you a balanced recipe, because their nutritional requirements are different than humans.
So anyone that recommendations on anyone that wants to try feeding their dog a vegan or vegetarian diet?
No.
There's a big no. Okay.
No. Especially, cats on a vegan diet. Ugh. Cats are obligate carnivores. That means they need to eat meat. They need 0 carbohydrates in their diet to function optimally.
So you're saying their diet, in order for them to be in top physical condition, would be just a meat, like basically a keto diet.
Yeah. Yep. But with appropriate vitamins and minerals.
Why do you hate animals?
That's just how it is, man. That's God. Talk to Him. I didn't make them that way. And no cat should ever have dry food. Dry food is 30 to 50% carbohydrates. Way too much, they become obese, diabetic. They get chronic constipation and obstipation, meaning they can't have a bowel movement. It's dry food, just bladder problems. Dry food gums up the works a lot in cats, and it does not help with their teeth. Everybody thinks dry food is good for the teeth. It's not. It makes no difference.
Okay. And I don't know if you've ever seen the show Scrubs. There's one of the old guys, the chief of medicine, Bob Kelso, says that the reason he stays up to date with things is because he goes to conferences at least once a month. Is that the norm for veterinarians, to continuing education?
Oh, absolutely. It is. Yeah, I get a lot of CE over the course of a year. That, interesting enough, in New York, it only became a requirement, I think maybe 10 to 15 years ago.
So before then, vets could have just graduated in 67 and never looked at another book. So they would have just,
Yeah.
So if you have now, do you just do that because you're an owner and that's your responsibility to pass it to the vets that work for you? Or is that any veterinarian? It doesn't have to be, they don't have to own the...
Any veterinarian now is required to have continuing education. And being an AHA certified hospital, I'm required to have twice as much continuing education as New York State requires.
Oh, how many is that?
I think it's 45 hours a year.
All right. And is New York the?
Or is it over 3 years? It might be over 3 years. I don't know. I get like that much every year anyway,
Yeah,
so I never worry about it.
Yeah. So is New York kind of the gold standard for it? Or?
No.
Oh, so
New York City requirements are lower.
Okay.
Fairly certain they're lower than other states. I guess because it was new, and when something's new, they're just trying to baby step people, and
steps in the right direction. Resistance.
Yeah.
All right. So the CE, and if you are licensed in New York, like, do you just pass a national board, or do you have to pass a?
Well, you have national boards and you have state boards.
Mm-hmm.
National boards, every veterinarian has to do. Well, the state boards too, but New York, you just write a check. You don't take a test.
Okay. Oh.
Other states, you take a test.
Gotcha. So that's a good way of screening for vets. Like, I know it's kind of. Do you do background checks on the non-vets, like the technicians or the assistants?
No. You mean when I hire?
Yeah.
Yes, we do. We do background checks.
So have you? Anyone ever apply that was like, hey, you shouldn't be around animals?
Not yet.
No.
Mm-mm.
Okay.
Not yet.
You never had any
No.
like weird ones?
No, well, we have weird ones,
Okay.
but nothing that came up on a background check.
Any clients that you had that had? I ask you a weird question. Like, have you ever had the sir, this is a Wendy's moment? I don't know if you know what that is. Or people show up to the drive-through, they ask for like a Big Mac, and like, sir, this is a Wendy's. Like,
man, yeah. I mean, we get all kinds of emotional reactions from people. Sure.
As far as like breeding or buying from puppy mills or not wanting to put their dog down because
all of the above. All of the above, yeah. I mean, I've had, people refuse to euthanize a dog that was just obviously in congestive heart failure and essentially drowning.
Oh.
And they would not put the dog down, and it just, that poor thing was suffering, And then you got other ones that want to put a 2-year-old dog down because it has a skin infection.
Okay, that seems a little extreme, but
it's happened. Well, the request has been made. I did not do it, but yeah.
So in your line of thinking, because in the veterinary field, it sounds like, again, just as a dog lover, saying like, it's suffering, please put it down. That's a humane thing to do.
Mm-hmm.
I think you have humane. You're doing that for humans in a couple of states. Why do you think there's a lot of not defense against doing that for humans?
Oh, it's human euthanasia?
Yeah.
Oh, because of the whole God side of thing and spirituality and religion, not spirituality, religion. That's considered a sin, and you're going to go to hell.
If you euthanize?
Yeah, that's it. That's all it's about.
So, do people think that dogs aren't going to go to heaven if they get euthanized?
There's less value placed on the life of the dog.
Are dogs still considered property?
Yes.
Okay, so that's why some things are still relatively cheap as far as surgery,
malpractice insurance and all that. Yeah, if dogs and cats get categorized as something other than property, the cost of veterinary medicine is going to skyrocket.
So essentially, let's say people that would love to, like animal lovers like myself, would love to have laws passed saying like, no, these are non-person humans, and this way they hopefully be treated fairly and X out puppy mills.
Mm-hmm.
But that in essence would make it how impossible to have multiple dogs if they get sick.
Well, the malpractice insurance would be so high, it would be similar to what it is with human doctors. So I mean, if you know anything about the price of human medicine, I mean, it's astronomical.
Yeah, I've seen people with like snake bites that it's like $150,000.
Yeah, there you go.
One, the anti-venom,
yeah,
and then two, the hospital stay.
Yeah, one night in the ER it'd probably be $30,000 to $50,000.
Oh, jeez.
So I mean, it would be a problem. It would be a problem. I understand wanting them to be categorized as something other than property, because it's I get it, and And that sounds right to me. But the practical side of it, if that happens, it's going to have consequences that many people just have.
They don't look at yet.
Yeah, they're not thinking about.
Have you ever worked with snakes?
Yeah, I used to have one.
Venomous, poisonous?
No, it was a Burmese python.
What's the difference between venomous and poisonous? I know one.
Same. There's no difference.
Are you sure?
Yes.
I thought like one is like
Venomous
deadly
poison,
and one is,
no.
or one is, I don't know. I forget.
They both suck.
No.
It's just the same terminology.
All right.
Different terminology for the same thing.
Any advice to handling snakes when dogs, especially small dogs, are around them? Like what to look out for?
Get the dog away from the snake and leave the snake alone.
All right.
Yeah.
I wonder what I guess it depends how much it costs. I've heard the only ways to get the antivenom is to have the snake bite a horse, and then because the horse can like take it, and then you get the antivenom from the horse's blood.
There are different ways that snake venom, antivenom is made, but that's not my wheelhouse.
Gotcha. I wonder what that means for vegans, because they can't use animal products. And if they get bit by a snake, does that mean they can?
Technically, yeah. If it's
they just die. Well, is that considered a form of euthanasia then?
No, that would be. I guess that would be more suicide.
Dumbassery.
I mean, I don't know. You might want to make an exception, in that case.
All right. So if you've covered snakes. So did you ever do large animal practice?
No.
No horses or cows or sheep.
No. I'm dogs and cats.
Okay.
That's it. No birds. No exotics. No farm. No horse. Dogs and cats.
So is that her dog fart in the background? All right. So in the idea of, you ever see that meme where it says like, all right, where do you draw the line about eating animals? And they have horses and ducks and dogs
and then
and
you
cats.
put the dog up
and you
there.
put the line. Like,
Yeah.
being travel the world, as I know you're in the military. Have you ever tried dog?
No, not that I know of.
Okay. Cat?
Not that I know
Anything
of.
out of the ordinary? Would you ever?
Snails, escargot.
Okay. You ever see those land snails? They're like 3 feet long. They're freaking huge.
Oh, Jesus Christ.
Yeah. Would you ever try? Well, not the land snails, but like, would you ever try dog or cat or horse?
I don't know. Probably not dog or cat. Horse is kind of like a cow, to me. And many people around the world eat horse.
Yeah.
It's not unusual.
Yeah, I've seen it in upstate New York.
It's not unusual.
Okay. So, what do you think of vets in China? I don't know if you've ever been, but the way that they have, like, they still serve dog and cat, and
that's a cultural thing, man. It's just different. That's all. It seems weird to us because that's not our culture. But I don't judge. That's what they do.
Have you ever had any, I don't know if it would be a Gen Zer or a young millennial, when you ask like if we were taking an appointment over the phone, if you ask like is it a boy or a girl, and then they ever say like, oh, I don't gender my dog.
Not yet.
No, haven't had that.
Not yet. Not yet.
Have you had any experiences with hermaphrodite dogs or cats that have?
Yeah.
What usually happens with that? Is there anything to fix it?
Nope. And you don't tell the owner about it.
Why not?
Because, well, at least the first time I found one, I thought it was cool, and I was telling the owner about it because it was a finding that I found, and I just thought it was cool.
You freaked out.
Freaked out. Wanted the dog to have surgery and all this kinds of stuff, because the dog, it was a female and it had a really large clitoris. And so if the dog's laying on its back and flipped open, it'll pop out.
Oh.
So I kind of didn't want the owner to see that, and then and then freak out about it, So, but freaked out. Wanted to have a consult with a surgeon, and
well, what did they want done?
They wanted it removed. I'm like, it's not going to hurt the dog or do anything. We just spayed her. So, it's like...
Like, was it out of concern of the owner?
No, it was...
Like, almost like homophobic?
Yes, it was all about her so the social implications of the term hermaphrodite.
Oh,
And I don't think I think hermaphrodite is not a politically correct term, but I don't know what is.
What is now?
I don't know what the.
But that's like a medical term. It's not like.
Well, yeah, but you know, they're calling it something else these days.
Them.
I don't. I have no idea. I have no idea but yeah, apparently, not to offend anyone, so I'm just ignorant on
Is
it.
it intersexual?
Intersexual?
I think
Is that a
that
thing?
was one of the terms. Yeah.
Oh,
I have no
intersex.
Intersex.
Intersex. Okay.
Intersex, that might be it. Yeah, I don't know. I don't know. Not trying to be offensive, just
So why do you think that some things that affect humans don't affect animals as far as, or maybe they do and we don't know, like gender dysmorphia or anything as far as.
Oh, because they can't talk to us.
I mean,
Because there's homosexual behavior in the animal
yeah,
world.
I've seen articles or pictures of a female lion growing a mane. I guess because there was a lack of male presence in that area. Have you seen anything like that with dogs or cats?
Other than the hermaphrodite thing,
No.
not really, no.
Okay, interesting. Well, that is, or did about a half hour, so this is good.
All right.
Dr. Mark Nunez, thank you.
All right, brother.
Doctor?
It was a pleasure.
Oh, yeah, it was fun.
Bye, everybody.
Bye.